Next up in the lead is a story that on its face sounded like bad news. An increase in the number of colon cancer cases, a significant increase in the number of colon cancer cases found in 45 to 49-year-olds. However, this is, in fact, an amazing success story because it coincides with an increase in screening. You may know, you may not know, that the age for colon cancer for that first colonoscopy screening, the recommended age is now 45. Dr. Scott Ketover, the president and CEO of MNGI Digestive Health, is with us. It is where I got my colonoscopy. So we visit with Dr. Ketover because on the face, this feels like bad news. But in fact, this is really good news, Scott.
I think the good news is that we're finding it in younger people at a stage when we can interact in a way that's more productive and decreases the amount of problems that patients have in terms of morbidity and mortality from colon cancer. So we're finding it at earlier stages.
Yeah, one of the data points in this new research from the American Cancer Society found that the number of screenings from those 45 to 49-year-olds is up 62% from 2019 to 2023, which to me is sort of an amazing compliance rate, right? Because we know that for years the date was 50, and to move it back to 45, I guess you didn't really know if people were going to do it or not.
That's true. When the recommendation came out to move the screening age back to 45, we didn't know what the impact was going to be. So the good news is that it's worked in everybody's favor.
Are these numbers similar to what you're seeing at MNGI Digestive Health, sort of a similar kind of explosion in people in that kind of late 40s? I know I was one who went over to your place and got my colonoscopy before I turned 50 because my doctor said to do it.
Yeah, we are. It's much more available in terms of the discussion that patients are having with their primary care providers or reading about in the lay press. I also think there may be a phenomenon that those who are in their fifth decade of life are maybe looking back on their previous 20 years and reassessing sort of in midlife, what are the decisions they made 20 years ago that they would make differently today and how that impacts their moving ahead in their future. And so I think they're more planful in what to do with their health. And we are seeing that materialize in more screenings for younger people.
Dr. Scott Ketover is the president and CEO of MNGI Digestive Health. Colonoscopies are a little different than some other types of early screenings in that you can actually take action while you're doing the screening. Can you explain that? Because I think that's sort of the difference maker when you think about getting that early screening.
Yes, absolutely. So there's lots of screening tests out there for colon cancer, but colonoscopy is the only test that can prevent someone from developing a colon cancer. So with all the other screening modalities, what we're really looking for is a marker that they might have something that needs further investigation.
Sure.
When you have a colonoscopy, it gives us the opportunity to find precancerous lesions and remove them in a very simple fashion long before they have an impact on one's health. And that's why we say colonoscopy is really the only screening test that can prevent colon cancer. And that's why we stand on the recommendation that it's really the gold standard for colorectal cancer screening.
I mean, you're probably seeing this every day at your locations, right? People in their late 40s that get a benign polyp removed, and you think, man, this maybe prevents something from getting worse and something potentially being deadly.
Absolutely. And what's astounding to us is because patients are coming in now, than the younger cohort in their 40s, is the percentage of patients that we're seeing that already have colon polyps, that when we remove those polyps and we look at them microscopically, they are precancerous lesions. And what we don't truly know is, would those lesions become cancers sooner than if we had found them 5 years later? So our goal is to find things in patients early so that we can impact in a way that prevents them from having illness going forward.
Pretty cool. Scott Ketover, the president and CEO of MNGI Digestive Health. It's a good start for sure. Long way to go, but good start here. Thanks, Scott.
Absolutely. Thank you for having me.